So we have just performed our osteopathic structural exam on our patient Walt, and we actually found that his somatic dysfunction is T7 neutral, rotated right, and side bent left. This was the area of the curve that seemed the most problematic, so this is the area that I will be redressing using the rotational component of thoracic articulatory technique. First, I want to find T7, so I'm going to come down to the inferior angle of my scapula, move to the midline, which is that spinous process of T7, and move one segment inferior to the spinous process of T8. From there now I can stabilize that spinous process of T8 either with my tripod grip, index finger on the spinous process, and the middle finger and thumb spanning out to the transverse processes, or with my thenar eminence, whichever is most comfortable for me as the practitioner. Now that I have stabilization of the inferior segment of T8, I'm going to bring my hand around my patient, letting my elbow rest in his sternum. Well, can you please take hold of my elbow with your hands? Thank you. Now I want my patient to actually be sitting up as straight as possible for this, so I just have him sit up as straight as possible. I will now be inducing a rotatory movement just to that T7, T8 articular facet, into that restrictive barrier. From here, I return slightly back towards neutral, and now again, I'm going into that restrictive barrier, and I'm attempting to go through the restrictive barrier every time I rotate my patient towards me into that restrictive barrier. Notice that I am standing at my patient's left side, so it's easy for me to turn him towards me. I'm not endangering my back with this positioning at all. So I am repetitively engaging this restrictive barrier anywhere from 10 to 50 times. Notice again that I'm using more of my body as well to induce this motion. I'm not just pulling with my arms, but I am really using my body to engage this motion. This enables my patient to feel stable and to really go through that restrictive barrier. And at this point, I no longer feel any restriction. This motion feels very free, very easy right here at this T7, T8 articular facet. So I will now bring my patient back to neutral. He can now relax his hands, and I will come back and I will reassess that T7 segment. And again, I had found that it was rotated right. And now I no longer feel that posterior right transverse process. Well, just please bend forward for me just one time. Good. I still do not feel posterior transverse process. Come back up and press your chest forward. Excellent, and relax. I do not feel it there. Now at this point, because it was a type 1, I could also check above and below just to ensure that I really did address that full somatic dysfunction. I could also reassess the somatic dysfunction in the manner in which I found it.